Do lockdowns work? It's a simple question, crying out for a simple yes or no answer. And that answer is... well, hold on. Let's just check the question again. It's not quite as simple as it seems at first glance. Whether something works or not comes down to what it is that you actually want to do, obviously. Now, the question might be, do lockdowns reduce the spread of COVID-19? Which is what a lot of people assume the question is. And all you need to know the answer to that is the science of epidemiology. And we'll look at the research on that in just a minute. But that's not really the whole of the question. So how about this? Are lockdowns the policy that will maximise human health and well-being outcomes in the pandemic? Now, that's a different question, isn't it? Because to answer that question, you have to know not only whether lockdown works in reducing the spread of a pandemic, but also whether the benefits of doing so outweigh the negatives of your chosen specific policies. You also need to evaluate the alternative approaches you might take to establish whether they would be just as effective, but with a significantly reduced cost. Of course, the problem there is that the costs may only make themselves fully known over a much longer period of time. But then the research can be directed there as well. But there's still something not quite there, because we know that there are a number of factors that muddy the waters. One of them is that national cultures are different, and some will result in greater compliance with the rules, and others will see greater resistance to the imposition of rules. Another is that if you've already done a lockdown, there might well be less compliance and more unrest for a repeat, for number 2 or number 3, than there was for the original. That would make a difference, because the positives would be reduced. It's not necessarily the case that the negatives would be reduced. So you might reframe the question, are lockdowns the policy that will maximise the human health and well-being in country X at this particular point in time? And in that form, it's a political question. It can be informed by the science, but the science isn't going to tell you handily what the answer is. It can come down to the authority and trust that the government has. For example, France has a significantly higher level of distrust in government by the population than the UK has, which is one reason why the numbers of French citizens saying they won't take the vaccine is massively higher than the number of Brits saying the same. Now, none of it matters at all if the basic mechanism just doesn't work. And there are certainly some people saying, quite simply, lockdowns don't work. It's one of those simple messages you can reduce to a slogan that will sound powerful to the ears of those who want it to be true. And maybe it is true. To most people's ears, it sounds highly counterintuitive, because at the level of the individual, of course, it's demonstrably the case that lockdown works. If I stay at home and have food delivered to me and never venture anywhere near another human being, I'm almost certainly not going to catch the virus. Obviously. But that's not the point. Any society has many people living in lots of different circumstances, some of whom must continue to work, otherwise the basic systems will fail. Others are all on top of each other. It's all about whether lockdown as a public policy imposed in a modern society works, with people the way they are, not necessarily the way we'd like them to be. In other words, whether it's successful in creating behaviour change that will restrict virus growth. If we're an authoritarian dictatorship that can physically lock people up, then they have no individual agency. Of course, we can guarantee that behaviour change. And we also know, because we have the example of New Zealand and Australia, that if you're in a country where you can effectively control your borders without egregious harm, and you act extremely quickly to the first signs of infections, you can follow a policy of containment that can be highly effective in the short term. And with a virus for which there is relatively quickly a vaccine produced, that may well end up being enough. But in the absence of those, how little is required? because if you can achieve the same beneficial impact for less disruption, then you can maximise human well-being by reducing virus spread while keeping the downside of your policy to a minimum. To know whether that's the case, you need wider-ranging research. It's one of those areas that has become deeply polarised. Proponents of lockdowns cite a bunch of research to support their claims. Opponents of lockdowns do likewise, and they highlight whatever research supports their preferred position, which isn't a process that should be confused with following the science. So let's look at some of the research and see what it tells us. I give links to the various papers in the video description below. In articles over the last 6 months or so, the one that seems to be cited most often as being the proof that lockdowns work is this one, estimating the effects of non-pharmaceutical interventions, referred to as NPIs, on COVID-19 in Europe by Flaxman et al. It studies the effect of major interventions, including national lockdowns, across 11 European countries through the first wave of the pandemic. And it concludes this: our results show that major non-pharmaceutical interventions, and lockdowns in particular, have had a large effect on reducing transmission. The paper calculates that non-pharmaceutical interventions have saved more than 3 million lives in Europe in that first wave. And it was really only lockdown that had the bulk of that effect. So that seems fairly clear. And it's the main reason why, unsurprisingly, it was heavily publicised at the time. Many articles saying that this piece had shown that lockdowns definitely work. It uses observation focusing on deaths because, of course, countries had significantly different approaches to testing. So recorded infections isn't consistent enough to provide reliable data. But we can assume that fatality rates will be broadly the same across countries, so it gives you some mechanism for working backwards and calculating what the infection level must have been to create that number of deaths. However, it feeds the observed death rates into its model, and you have to look at the assumptions that are built into such models to check that they fit real life and the research objectives and everything. And this is where some scientists have said that there's a problem with this highly cited paper. A response to Flaxman et al. Was produced about a week after it was published, although it itself was only published about 6 months later by the journal. It argued that assumptions that were made in the model were basically leading it to come out with the answer that it did. The peculiar aspect of the claim that lockdown accounts for 81% of the reduction in R0 is that Sweden did not implement any lockdown but still see a similar decrease in R0 as the other countries, even though the other NPIs were reported to have no substantial effect on the R0 number. There was a complicated adjustment that was made to the paper to deal with this. Without going into the technical detail, the essence of the article was that the model was primed to see lockdowns as the most significant intervention, and therefore the model came out with exactly that result. And the authors were aware of this. They partially flagged it in their introduction. Our model relies on fixed estimates of some epidemiological parameters, such as infection fatality rate, and assumes that changes in RT are an immediate response to interventions rather than gradual changes in behaviour. Statistician Andrew Gelman, commenting on the paper, said this all seems reasonable to me, except for near the end where they say, our results show. They really should have said, our fitted model implies, or our model estimates, or the data are consistent with the conclusion that. Instead, they said, our results show, and that led everyone to write up the paper as proving that lockdowns work. Which is what the abstract says, but not what the paper actually proves. And this is part of a challenge for any of this research. Ultimately, it's incredibly difficult to be able to disentangle all the different factors that would be at work in any specific public policy measures. So much of the research on this is based on computer models where assumptions are programmed in, which may or may not be valid. You have to check. And then they can be reported in a much more definitive way by the papers than their method would support. Take this paper as an example, quoted by some as one of a number that's supportive of lockdown. It predicts 350,000 deaths in the UK by December 2021. with 4 different interventions likely to decrease the toll, but not sufficiently to prevent ICU demand from exceeding health service capacity. Only the most stringent lockdown scenarios resulted in a projected 120,000 cases. It provides an interpretation that's simply this: the characteristics of SARS-CoV-2 means that extreme measures are probably required to bring the epidemic under control and to prevent very large numbers of deaths and an excess of demand on holiday beds, especially those in ICUs. That may be right. Note the word probably in there. But nobody should think the projections in that paper somehow prove that policy conclusion. You only have to look at the method section of many of these papers. So this one says this: projections for the relative impact of the various physical distancing measures explored here are estimates only. The COVID-19 epidemic is without precedent in recent history, so it was not possible to make substantially data-driven assumptions concerning the impact of non-pharmaceutical interventions on contact patterns. Now, that's always the case with these model-based projections. You can review the literature and get the best supported estimates for some of the factors, and some you simply have no real information about at all, so you have to make an informed guess. You might run various different scenarios with different values, which will give you a range of possibilities. Some of the studies do that. All of those can give you some useful indications that will inform policymakers with a balance of probabilities, but only if they're able to understand the assumptions that have gone in and what they're based on. All too often, the newspaper reporting doesn't begin to get involved with that level of detail or uncertainty. Computer modelling can be a hugely powerful tool when you have known parameters, or mostly known parameters. In this case, where you're trying to model the effectiveness of certain policy measures, so much of it is unknowable, because often the policy measures were introduced in rapid succession, but the impacts were only seen after a certain time lag. Ideally, therefore, the evidence begins to move beyond the computer modelling approaches to statistical analysis of real-world observations. A model is useful for developing a hypothesis, but its results should be tested against real-world outcomes. We do see some relatively straightforward evidence that changes in behaviour and/or policy influences outcomes. Although after the first wave, there were some who were arguing that the virus did what it was going to do regardless of policy, that doesn't entirely match what we saw. For instance, in the UK, with the fact that the different regions of the country declined more or less in unison, even though certain regions had been hit harder than others. They were later in the curve than the others. Had there been no impact, you would have seen each region follow its own curve on its own timeline. So there's certainly some impact, but that blunt level of analysis isn't going to tell you what policies make a difference. Now, recently, a new paper was released that tried to move beyond the model projections to look at what happened to date in different countries. Brindavid et al. We should note that one of the authors, Jay Bhattacharya, was one of the authors of the Great Barrington Declaration. I'm always a little bit nervous of scientists who become campaigners, because once you've staked yourself publicly on a position, it's likely that you will look for evidence to prove yourself right. It's just a human thing to do. Now, it just might make you a less effective scientist, but then that's the point of peer-reviewed research. It shouldn't matter who the authors are. The assumptions and the method of the research is detailed, so you can check for yourself what was done. This paper carries out a statistical analysis of what had happened in a number of countries that had locked down and compared them with the 2 main ones that didn't, namely Sweden and South Korea. Sweden and South Korea didn't do mandatory lockdowns, but there were advisory policies with light restrictions, and these resulted in basic behaviour changes in terms of social distancing. So the question the research aimed to answer was this: if you compared the impacts of behaviour change in all the countries, how much demonstrable difference was there between that was added by the strict lockdowns over and above the other behaviour change measures? They estimated COVID-19 case growth in relation to restrictions in subnational regions of 10 countries: England, France, Germany, Iran, Italy, Netherlands, Spain, South Korea, Sweden, and the US. They used the case growth in Sweden and South Korea, the 2 countries that didn't implement lockdowns, as comparisons for the other 8. And they tried to isolate the effects of a mandatory lockdowns by subtracting the combined effects of the light restrictive policies and the general behaviour changes from the major lockdown impact. And they confirmed that policies impacted the expected growth curve of the virus in 9 out of 10 countries, with the exception being Spain, where its measures seem to have the least effect. It'd be interesting to know why that was the case. More importantly, it said it found no evidence that the more restrictive lockdowns contributed substantially to the bending of the curve in new cases. Not only that, it said that the results of measures were surprisingly similar, despite a wide variation in the detail of all of the different national policies. Our behaviour model of NPIs, that their effectiveness depends on individual behaviour, for which policies provide a noisy nudge, helps explain why the degree of NPI restrictiveness does not seem to explain the decline in case growth rates. Data on individual behaviours such as visits to businesses, walking or driving show dramatic declines days to weeks prior to the implementation of business closures and mandatory stay-at-home orders in our study countries. So the point is that in the countries that didn't lock down, substantial behaviour changes were made by the population anyway, and that achieved as much or nearly as much as the more restrictive policies elsewhere. You have to note that the sample of non-lockdown countries is necessarily small. So the question I immediately ask is whether these two countries did what they did because they had populations who would voluntarily change behaviour, whereas other countries might have failed to get the same level of change without the more restrictive policies. Because what this paper doesn't show is what some would like it to show, which is that you can run around going about your business as usual and it will make no difference. It confirmed that behaviour change is key to controlling the spread of the virus. It comes down to the question of how little coercion can you use to get the desired result, which is a less profound point of difference than people would like it to be. The point is that people were adapting their behaviour before lockdowns were officially enforced. Naturally, there are no hard and fast statistics on exactly how that played out. There are a few compelling proxy indicators, like this one on public transport use in London. As you can see, as the pandemic hit, people began to adjust their behaviour in a significant way. Really, that line to signify when lockdown started seems an insignificant milestone, because it simply intersects a already rapid downward trend without much obvious additional impact. A little, but not much. So when people look at the figures and suggest that infections were on their way down before lockdown was imposed, that's entirely possible because behaviour had been adapted. And if that recent paper is right, it could well be that the adaptations that people were making pre-lockdown went a long way to doing what needed to be done. And doing less comes with less negative impact. Plenty of Swedish jobs were lost in 2020 because even voluntary social distancing changes represent a significant impact on businesses. But it has been a lower impact than many other countries. Now, there'll be some wanting to jump on that as the validation for their belief that lockdowns don't work. You need to bear in mind it's suggestive, but it's not proof. Then there's another aspect to all this, that if we're being serious about the situation we find ourselves in, we should be paying more attention to than people currently are. Right now, the vast majority of people support lockdowns. You might argue that's just because they've been provoked into panic by government messaging, and there's no doubt that since they decided to lock down, they have been targeting that messaging for sure. Indeed, as I discussed in the nudge video a while ago. But remember, the UK government was originally keen to take the Sweden route. It was pushed into lockdown by the messages from the model projections that were produced at the time and the reaction to those by a host of activists and journalists who demanded that the government match the actions that other countries were taking. They were told that their slow response was killing people. Ultimately, they decided that politically they had to act. You may not like it, but that is also a factor. The politically possible comes into play in terms of how long you can hold a population in lockdown when they've had enough of it and will fail to comply, but it also comes into play in terms of the overwhelming expectation of the opinion formers that a serious problem must be met with a commensurately painful medicine, or else it's not proportionate. The UK and America, along with Italy and Spain and Belgium and others, have seen a significant number of deaths made more urgent by constant media attention and the distress of the health service in coping with the levels of demand. And it's why we've been apparently swimming in absurdities in recent months. Why we've been debating about what does or doesn't constitute a substantial meal that you're supposed to be having if you're having a drink. Debating whether a couple of cups of tea in the park constitutes a picnic. It's because when things are bad, we retain the belief that we have agency. If things are bad, it's because public policy isn't tight enough. If only we could make it more punitive, then it would be more successful. And it's one of those unfalsifiable things. If we tighten up and nothing improves, it's because we didn't tighten up enough. If only we did it more or quicker, it would have worked. If the figures go the right way, well, it's because the policy worked. It's never that there's, a pandemic and we can do a number of things that might help, but ultimately it's going to hit us in spite of the reasonable things that we would do. Sweden took the approach where they brought in basic social distancing measures and then they just stuck to it, in spite of the fact the numbers were pretty bad. Even there, ultimately the ability of the government to hold firm in its approach eventually crumbled. In the UK, the numbers were pretty bad, and we changed the policy every week or two, trying to show that we were taking action, looking at the relationship the British people and the British press and the British opposition parties have with the government. It might well be we were never able to hold our nerve with a lower level of action in the face of that impact of the pandemic. If we'd gone the Sweden route and our outcomes had been exactly the same as they turned out to be, everyone would have been saying that we'd had a much worse outcome because we took the Swedish route. Nobody would be able to prove otherwise. So that's relevant context. Is lockdown the right policy for the UK right now, in the middle of this winter second wave? Probably yes. Maybe because the new variant is more virulent and demands the extra strict measures from us? Maybe. We don't have proof that measures that were effective against the first variant would be less effective against the new one, because we can't tell whether it might not be because we're not socially distancing as carefully as we were the first time. But even if not, possibly because it would be politically impossible for the government to do anything else given the outlook of the country. On that basis, I think, pragmatically speaking, the game changes. The debate is soon to start about how soon we should or should not begin to emerge from lockdown as vaccines are rolled out. The voluntary social distancing approach will simply not be seen as sufficient when the figures are so bad that everyone wants to be in full-on lockdown, but it may be that it's winnable to argue that it should be an early go-to position for the beginning of emergence from lockdown. And apart from that, it should really be a priority to work on better understanding of which policies have the best impacts and which have the most harms, because all of these equations are going to shift over the coming months as new research brings new insights, maybe challenges and overturns to what we think we've established today and covered in this video. This video is of its time, a mark in the sand against a work in progress. It can all change. But with that caveat, do lockdowns work? Probably yes, but with a major cost. And if your society can achieve behaviour changes for basic social distancing without one, then you're probably better off going for that. If you can get the permission of your population to do it that way, and you probably can't. But even so, stupid micromanaging about whether people must have a substantial meal or not, whether they can cycle 7 miles or if it has to be 5 miles, none of those things have any supporting evidence whatsoever. Simple, straightforward, common sense behaviour changes. Everything else is about how it looks, not how well it works.